Good morning, and welcome to this special edition of In Focus on Whitewater Community Television's WGTV Channel 11. I'm Eric Marsh, Executive Director of Whitewater Community Television. Glad you're able to join us, whether you're watching on WGTV, whether you're watching on our streaming site, WGTV Online, or whether you're watching on Facebook Live. We've got an hour. I know we said it was going to be 90 minutes, but getting the legislators out in here and some of the other things that they have to get done, we're going to cut this down to an hour. So we are taking your questions via Facebook Live. If you have a question for the legislators, you feel free to put that in, and we will try to get them to answer that. We're going to give them a chance in just a couple of minutes to talk about a couple of bills that they have kind of shepherded through or really have seen a lot of interest in. And then Dr. Minji Parker from IU East is here with us. I'm going to turn him loose on them. I'm just going to sit back and enjoy this one. Thanks for watching. A couple of things I want to remind you before we get started. There is still time for you to register if you want to vote in the primary or if you just want to get a jump on the general election. Voter registration does continue at the voter registration office, 301 East Main Street, Monday through Friday, 8:30 to 4:30, or you can check your voter registration online, indianavoters.com. You can check your status. You can also register there. If you need more information, you can call 973-9304. There's also a website there if you want to check out what's happening at the clerk's site. We are going to have Mayor Dave Snow and Challenger Jack Cruz, who are running for the mayoral spot in the Democratic primary. It is the only primary race. They will be with us on Thursday night, April 18th, beginning at 6 o'clock, and that is going to be a 90-minute show. We're not going to let them out early at all, so we are taking your questions now. If you would like to send those to us, you can do it at wctv@iue.edu, or we will be taking your questions again via Facebook Live or Twitter during that show. So once again, if you want to hear from the candidates, Thursday, April 18th, 6 p.m., we'll do a special In Focus candidate forum along with our partners with the Wayne County Area Chamber of Commerce. Want to thank, first of all, Representative Brad Barrett for being here. Thank you very much. And State Senator Jeff Raatz, thank you both for taking some time out. I know you just spent an hour answering questions from some of your constituents, so I appreciate you taking the time to come over and join us here. If you've been watching the legislative forums that IU East has been holding really for the last couple of years, the host has been Dr. Minji Parker. And Dr. Parker, except for today, actually got to ask a question, but for the most part, he hasn't been able to do that. So we got him here so that we could get some of his questions out. But we're going to start with Representative Barrett and State Senator Raatz, and give you a couple of minutes just to talk about bills that you have kind of helped shepherd through, that you've shown a particular interest in, or that you feel the community really needs to know about. We'll give you a couple of minutes each just to kind of go through whatever it is that's on your mind.
Well, I guess I'll start. As a new legislator, you know, my purpose, I didn't feel like was to go over there and create legislation in a process that I knew nothing about. And just new to this arena, my goal was to go over there and to learn the system and learn the process, to build relationships, to gain credibility. And yet there was one thing that I was really, I felt important, and that came through my medical experience, and that was the Stop the Bleed campaign. And so I've been a member of the Indiana chapter of the American College of Surgeons, active participant in State Medical Association, and so we had this initiative come up through the American College of Surgeons, and it was for Stop the Bleed training. And the idea was that in today's environment, that a civilian response to bleeding could save more lives than CPR. And it's a two-pronged approach. One is provision of a kit that has some important materials, including tourniquets and gauze, scissors, and then the other is training. And in reality, the training is more important because in an emergency, you can use a t-shirt or a tie, a belt. So it's educating the public as to how to respond to bleeding, whether it's an automobile accident, a shooting, a tornado or a natural disaster, broken glass, a playground accident. We thought the entry point for this in the state was through the school system. And so although this I felt very passionate about, I didn't, quite frankly, understand the system. And so I took the opportunity to bring this initiative to another representative, and that's Representative Fry from Southern Indiana. He had been a firefighter and was retired. He chairs the Public Safety Committee, and really thought this was the avenue to get that through. So Representative Fry was kind enough to take this initiative on with me as a co-author, and he heard it in his committee. We received really great feedback on this initiative, and so it actually went through the Public Safety Committee. It went to the House. It flipped over to the Senate. And I don't think we've had a dissenting vote on this. I mean, I think it is really a strong initiative. And the whole idea is we partnered with Department of Homeland Security and Indiana Hospital Association. We partnered with EMTs, law enforcement agencies, firefighters, school nurses, educators, Department of Education, the school principals, and with all these stakeholders involved, we got donations through the Indiana Hospital Association for these kits. The goal is to get these kits into every school in the state, and then for kind of a multi-modality training. Several surgeons and EMTs, local EMTs, actually did a quick training to the Public Safety Committee. It was well received. In some areas, this has already gone out into the schools. I think there's been some articles in our newspaper where some of the EMTs have been providing kits within the community. But our initiative to get these into the schools is really been received quite warmly. And in fact, as I've participated in the Indiana chapter of American College of Surgeons, I've been given the opportunity to present this initiative in Washington next weekend to the national organization, the American College of Surgeons. So I'm excited about that, and I think in terms of the United States, we've kind of paved the way with this initiative. There's been some other attempts to get this through on state level, some through budgetary processes, some through the Indiana Code, and we found great success in this. So that's the thing I'm probably the most excited about. But otherwise, it's learning the system and the processes and developing relationships and really trying to be a voice for Wayne County.
Okay. Senator Raatz.
Thank you for having us today, and I'd like to say Brad was able to bring that bill over to the Education Committee, so we heard the bill and had a great time. And that bill is a great bill. There's no two ways about it. It's going to actually save lives. I'm certain of it. If folks have a situation where they're bleeding profusely and they need a tourniquet, so hats off to Brad and Representative Barrett. Let me keep professional here in his efforts, and Representative Fry. So most of my time is spent on education, and we know we have a shortage in many areas, not just the teaching profession, but so I have multiple bills out there to address some of the issues that happen. And so while the teacher pay issue is actually part of what the governor's initiative was, I'm going to leave that alone because that's a whole nother issue. Not that it's a good, I think it's brilliant what the governor proposed to prepay a pension fund and free up some of the money locally. I would like to say, preface the whole conversation on teacher pay that the General Assembly has never dictated what teachers should get paid. It's a local issue, so the school board, along with the local bargaining unit, they're the ones that set the scale. Now, that doesn't negate that the General Assembly doesn't have a piece of the puzzle, and a fairly large piece of the puzzle by the finances that are sent to each school district. And so that's an issue that I certainly have a partial voice in, but I went on some of the peripheral things. I looked at, we're taking a good hard look at, one, the teacher prep exam. Some of the research that we ran into last year was that some teachers are having a difficult time passing the exam, and so we're taking a look at prep schools and what actually is happening there. So I have some reporting requirements that will help us kind of sift through some of the data and be able to discern if it's the prep program, is it the licensure exam. We also have a bill that would change the way that the exam that we use in the state. As well, there's one metric in code that dictates how a teacher would get a raise based on experience and education. And it would eliminate a metric of 33% when a district's considering a raise for a teacher. Only 33% of that raise could be considered, and that would be their education and experience. We're going to eliminate that to try and free up. It probably won't have a massive impact across the state, but so one of the things I learned when I got over there now in my 5th year is that when we look from the outside, we said, well, gosh, if we just do this, everything would be okay. And you get over there and you find out if you did this, well, there's multiple domino effects to other areas, and so it's just not that simple. Essentially, at the end of the day, I think I learned my best lesson up in Randolph County when we gave some relief to property tax for the farming community that was actually on a trajectory straight up. And when we gave them relief, I thought we hit a home run. Then I got to the local legislative update, and one of the county commissioners just came unglued, said, "You just cost us $500,000 annually in our budget." So that comes back to the point where what you do here, there's always a cause and effect relationship, and so certainly spending most of my time on education, and those are a few of the issues that I'm proud of that we're working on, 3 or 4 of them in the education space.
You're watching In Focus on Whitewater Community Television's WGTV Channel 11, also streaming on WGTV Online, as well as on Facebook Live. We're going to turn it over to Dr. Parker and let him start the questioning.
Okay, thank you. The first question I'd like to pose to you gentlemen. It's been very well publicized that the President signed into legislation the criminal justice reform at the national level. The first question is, are you aware of any legislative initiatives for the state of Indiana that looks at criminal justice reform at the state level?
Well, I have a little bit more experience, and we'll see. I sat on correction of criminal code for the first 2 years I was actually 3 years I was in Indianapolis, and so. Back in 2014, 2012, I think it was 2012, 2013, 2014, there was a massive rewrite of Indiana's criminal justice code, which hadn't necessarily been really dug into since the mid-'70s, so there's about 40 years of history and a bunch of add-ons, and of course there are pieces of law that probably aren't followed as well because they're antiquated, but they still may be on the books. And so since 2014, I would call it a gentleman's agreement between the House and the Senate that we wanted to step back and see exactly how the reforms worked. Maybe a lot of that had to do with sentencing. We went from a felony dictionary of 4 different levels of felonies to 6, and then also sent the lowest level felonies to the local jails instead of into the prison system to try and hopefully that the recidivism rate would be less if they were at the local level. And so those are just some of the things. And so since then, since 2014, all that to say, there was a gentleman's agreement that we just set back and let's see how well we did with what we done. And for the most part, that's been followed. There's always changes, but they've been minimal. Right. I hope that answers your question. At least we'll see if the federal government did it. There probably will be some things that trickle down to the states that will require us to follow along.
Right. Mm-hmm. And some of the things I was thinking of specifically are the sentencing guidelines. When you look at the sentencing disparity between possession of crack cocaine versus possession of powder cocaine, those types of reforms to make those sentencing guidelines have a lot more parity.
Sure.
Those are the types of reforms that are really sweeping across the nation. Mm-hmm. And I just wanted to touch base and to see if Indiana was participating in those types of reforms. There's also always questions about the issue of sexting. And a lot of times we look at sexting as a mental health issue or a sexual health issue or those kinds of things, but it also has a very definite criminal justice aspect to it. human traffickers use sexting as a way of, promoting, their services and whatever. But we also see a lot of pedophiles who engage in sexting as a way of finding victims and those types of things. Are you aware of any legislative initiatives being put into place in Indiana that would help protect victims of human trafficking as it pertains to sexting? Because oftentimes sexting is the primary method by which people begin this process of human trafficking.
Well, I know on the House side, we've had some exposure to the whole human trafficking issue, which, quite frankly, 6 months ago, I didn't realize was such a big issue even in our own state. And so there is definitely an awareness. There is no new legislation this year on sexting that I'm aware of, but there is on revenge porn, like
Right.
where maybe an intimate photo that's been shared in a personal relationship then is distributed without that person's consent. So, which I think is a little bit different. When you talked about the sexting, sometimes we're talking about teenagers and smartphones and relationships, and I think some of that may ultimately have a harmless intent, and that then if a relationship goes bad or if those images get into the wrong hands, then it can be used really as a leverage and as a weapon. And so we have addressed not the sexting issue but the revenge porn. I think there have been a couple cases across the state over the last couple years that have brought this to the attention, and we're trying to put some guidelines into place. I think the challenge is technology now. We've seen such a growth in that now now we're finding applications, and some of those are for good and some of those are for evil. The fact that it's being used in human I think it's constantly raising our awareness that we need to adapt and adjust to these new uses of technology, and then catch up with the code.
Yeah.
So.
And that, I know that's a challenge, a consistent challenge. Is the legislative process is never as quick as the technological development. That's always going to be a challenge.
Unfortunately.
Yeah. One of the issues that we are seeing along the same lines of sexting and revenge porn is sometimes you will have juveniles who will engage in sexting, which technically, that, according to the letter of the law, is disseminating child pornography. And we've seen juveniles get caught in that kind of thing quite frequently. And so that's the type of thing that would be difficult to address, but it absolutely is necessary to help protect both the juveniles
Sure.
as well as people who are going to seek to victimize them.
As you look at that, how fast can the legislature move? You admitted that you didn't realize that there was the issue with as large an issue with human trafficking. Now that you're aware of that, how fast can the state legislature begin to address an issue like that is wide-ranging throughout the state and is detrimental across the board?
I get the sense that we have the maneuverability of a cruise ship or a barge. I mean, it's a slow process to do things right. I think there can be the ability to add an amendment or to make a change that isn't vetted really as appropriately as it could. So in my limited experience, I see us able to make sharp, quick movements, but I don't think that they're always with the same depth and thought that some of our grander movements are made with. So,
Sorry.
Would you think that's?
Oh, absolutely. So I think that's right. So, and just very quickly in the process, so every legislator, if they're present every day, has the ability to vote on every single piece of legislation that goes to the governor's desk. So this starts in the Senate, and we come to a halftime place. What's done in the House comes to Senate. What comes to Senate goes back to the House. It's vetted both publicly and in committee, both in the House and the Senate. Every piece of legislation, every legislator will have the opportunity to vote on it. So while the process is a little bit slow, I think Dr. Barrett is absolutely correct that, and even sometimes it's ugly and it's an arduous process. But at the end of the day, what comes out is something that's well vetted as best as possibly can be. I think we have seen us move very quickly on a couple of issues that were minor, that didn't take a lot of vetting, but Barrett's absolutely correct in the fact that as a committee chair, if there's a piece of legislation that you have out there and then someone wants to amend it on the floor that hasn't been vetted in committee, the proper way is you should have had that piece of that concept up front so it got vetted properly, because that's where the real work is done, is in committee with public testimony and the professionals that operate in those specific areas and have a lifetime, like Dr. Barrett in education, or excuse me, in the medical field, and myself somewhat in the education field. You got to have people that have backgrounds to be able to have input. And so while the process is a little bit slow, it's necessary to be that way.
Okay.
Now, I'll also add to that. That being said, I've had some exposure to things that we're doing preemptively. And there was a bill that came through the Healthcare Committee that involved transplants for the disabled. And one of the questions I asked was, has this been an issue anywhere? And there was no knowledge of that, but the thought was that it potentially could be, and we wanted to be proactive and have legislation in place to prevent a problem. So although I think most of what we do is reactive, there are the occasional times where you see something done proactively, and I think it's encouraging.
Sure.
You're watching a special edition of In Focus on Whitewater Community Television's WGTV Channel 11. We're joined by Representative Brad Barrett, State Senator Jeff Raatz. If you have a question for us, you can send it in. The information is there on the screen for you. We're also joined by Dr. Minji Parker from Indiana University East, who has the next question.
Okay. Staying with the idea that a lot of times the legislature is tasked with dealing with problems that were previously, not really, didn't have a high degree of awareness. Sure. One of those issues in the criminal justice field is law enforcement accreditation. And there's a body, Kaliya, the Commission on Accreditation for Law Enforcement Agencies. It's a federal accreditation process that basically looks at the policies and procedures, as well as equipment and general orders, standard operating procedures, and those things of different law enforcement agencies, and accredits them based on the fact that they are using best methods and that they are doing things in a fair and impartial manner. The question is, I don't know if there are any state initiatives to require all of the law enforcement agencies in Indiana to become Kaliya accredited. Typically, the accreditation process is voluntary. And what we see, the Bureau of Justice Statistics site lists 482 law enforcement agencies in the state of Indiana, but the Kaliya accreditation site says there's only 20 law enforcement agencies in the state of Indiana that have Kaliya accreditation. And there are different types of accreditations. You can have a communications accreditation or jail accreditation, but we're just talking about the law enforcement agencies. The records show there's only 20 Kaliya accredited law enforcement agencies out of 482. My question is, if there isn't currently a legislative initiative to require law enforcement agencies to become Kaliya accredited, is that something you would support?
Well, first of all, let me say that even looking locally here in Wayne County, the Sheriff Kappa in the last 8 years went through a very arduous process to get the jail accreditation, and we're very proud of that, what he accomplished. And as well, now Sheriff Rutter in the process to make sure they maintain that accreditation. We know it's a difficult process when you talk about accreditation, and quite frankly, Kaliya as a national organization, I'm certain it's a great organization and they do a good job. Traditionally, for the state to require every law enforcement agency to be accredited by a single body, it would take a lot of conversation, because very often the conversation is based in, is it local control or is it state control? Is what you're proposing the best thing? I'm certain that there are, maybe it's 80% of the people would say it was the best thing that ever happened, and maybe 20% would say they'd rather do what a different accreditation. So while maybe only 20 out of the 480 are accredited, some of the research I did actually in this arena, there are other accreditations out there, and some of them are based right here in Indiana. So I think the conversation then becomes, what are you going to do locally? Could it become something that we do? The answer is yes. But again, I'd go back to the very fundamental question: do we as a state want to require every law enforcement agency to make sure they're done by one organization? Even in processes that we look at, there's requests for quotes that go out, and pieces of legislation that one of them that I'm carrying this year is absolutely has to be vendor neutral, so that we're not dictating who does what. This may be a different situation, but that's certainly a process. The quote process has to be vendor neutral, at least in the cases that I'm have been a part of.
Right.
So those are the larger questions, I think, and that does not say anything negative. It's probably a very good accreditation, and maybe it's something that we should do.
Right, and this is a little different process. This is not necessarily a vendor-related situation. This is a law enforcement commission, and it's very similar to the Joint Commission standards for healthcare. And so this topic comes up a lot in the field of criminal justice, and as a criminologist, we are often asked this. And I had a student once who asked me, would you let your kid go to a hospital that wasn't accredited? And I said, well, I don't have children, but no, the answer is no. I would not want my child to be treated at a hospital that wasn't accredited.
Sure.
So this is more similar to like the Joint Commission accreditation that hospitals go through to make sure that they are following standard operating procedure and best practices for the field
So
of
are you
medicine.
saying that there's no cost to it?
No, I'm not saying that. I'm not saying that. One of the issues that agencies say is they can't afford to hire an accreditation manager to manage the paperwork because Kaliya requires agencies to analyze their data and to show that they are not using bias-based policing every year. They require them to analyze data on traffic stops, to analyze data on their use of force, and it's that type of requirement. The oversight is at the local level. As far as the responsibility of policing practices, it's local level. The agencies that are accredited do have to submit reports, basically assuring that they are not engaging in bias-based policing and that they are following best practices in law enforcement. So if there are other accreditation processes, if for whatever reason we don't want to use Kaliya, we want to use another accreditation process, I think that would be fine. The bigger issue is, do we want Indiana law enforcement agencies to have some type of accreditation standards to which they are held to make sure that they are, doing law enforcement the way that it should be done?
Well, I think as legislators, we have a duty to ensure that Hoosiers are protected and get quality services no matter what avenue that is. So whether it's law enforcement or healthcare or education, we want to raise the bar in this state in terms of providing quality. Apply it to whatever arena you'd like. I personally don't know much about this Kaliya program, and I kind of rely on this idea that, let's get the experts in the room. You know a lot about this. I'd love to hear what our local sheriff thinks. I'd love to hear what our state sheriff's association thinks, other law enforcement agents. It sounds like this may be an opportunity to do something proactively.
Yes, and that's one of the things I can say that Wayne County has been very proactive. They are one of only four sheriff's departments in the state of Indiana that are accredited, and their jail also is accredited. So they actually have two accreditations, which is definitely a feather in the cap.
Yeah, I want to make sure that you know that I'm not against it. I'm just saying there's a process, certainly, and then the local versus the state oversight is probably the baseline question. But certainly making sure that we're doing the right things for the right reasons.
Sure, definitely. Now on to another topic, or off of criminal justice topics, to a certain degree. There's been quite a bit of concern about e-cigarettes. as far as the health risks that e-cigarettes may pose, especially to younger people who are using them. Are you aware of any legislation in the state that is aiming to address
Brad
that
Starks,
topic?
there's an initiative in the House.
Yeah, so on the House side, I mean, there's been really a huge discussion already this year about smoking, health, and e-cigarettes. And I think some of that goes to the federal level as well. I think, and it's hard to it's not hard to understand that smoking is not good for you. And it's not hard to understand that these e-cigarettes bring a health risk as well in terms of nicotine delivery, particularly to children. And there's some thought that e-cigarettes kind of came about with the idea of transitioning people off of traditional smoking and tobacco, and it would allow kind of a similar mechanism of delivery and a certain nicotine content that was controlled and be a benefit in smoking cessation. However, the different flavors in the cartridges and the appearance of the pods or I'm going to get the language wrong, but the way you smoke that had become appealing to adolescents, and so I've found some of these things in my own kids' pockets and drawers, and which concerns me because it's a nicotine delivery system, and there is no lack of data that shows nicotine is not beneficial to the developing adolescent brain, and it's an addicting substance as well. And so, I think here's an example of something that the intent was for a positive health benefit in smoking cessation, and then in reality, it created some access to nicotine and products to a group that we didn't feel like they should have that. And so the first step this year at the state level was to start with a small tax on this product, and with the idea that we would come in line with adjacent states and kind of send out a warning flag that, hey, we are interested in the state in seeing this go back to its positive use in smoking cessation and away from its popularity in adolescent and young adults, and ultimately, I think, use this as a stepping stone to look at the health in our state and the negative effects of smoking and nicotine use in general. So there's a start, and I think I'll be anxious to see over the next couple of years then how this issue progresses through the system. So.
And that I agree with Representative Barrett. Absolutely. So we're now beginning to talk about the bill he's speaking about in tax and fiscal, and so that's I sit in that committee. So it's on the horizon. We're going to be taking a good close look at it to see actually exactly what he's talking about. So we add some tax and see the effect that it has out there. While it may seem minimal to start with. There's been conversation about moving the smoking age to 21, and there's all kinds of different conversations every year when it comes to smoking. $2 a pack tax on traditional cigarettes, and so this is where nothing started in the Senate, started in the House, and so we're going to support this thing and hopefully see it come out the Senate back to the House and begin the process.
Do a quick follow-up, and you mentioned there's not much debate that smoking is bad for you. You mentioned there's some conversation every year as how to move this needle. At what point does the legislature stop the conversation, understand that the health of Hoosiers is at stake, what the state is paying in insurance, HIP 2.0, what we're paying for it is a detriment to the state, and begin to figure out how to move this along? I know there's always a back and forth. I know there's always a give and take. I know people lobbying on one side and on the other, and we talked about lobbying this morning, and that's not all bad. But at what point does movement happen?
I honestly don't think there's been anybody advocating against the tax on cigarettes. There's been people advocating for it, and so there's just not that big of an appetite to do so. And I think quite frankly, when we talk about behaviors, there's a larger conversation to have. So if I'm a self-imposed diabetic from eating too much candy, so it's a behavioral issue. I mean, and all these things are cost a tax to the system in health for health reasons. We talk about the medical marijuana and that becoming something. And so I would come back and say, why in the world, when we have the ability to pull THC out of marijuana, why would we legalize smoking it for medical benefit? Why don't we put it in a pill form and give it to folks? And still there's a large conversation over the top of that, the effects on the brain and the age of which that stuff is taken. So there's a lot of conversation. At the end of the day, even you think, one of the things I think about when we talk about $2 a pack on cigarettes, so the folks that may be smoking, if depending on their income level, maybe they're taking food off the table to continue their habit. And so there's a lot of conversation to have. It doesn't mean we don't do it, but it's a little bit more in depth, and that's how we need to look at it from the state level when it comes to that. And so that, I agree with you wholeheartedly. Just there's some other factors that are involved, I think, in the conversation, at least I like to look at.
And then I would add that is your tax created to raise funds to cover health care? Is your tax a deterrent to use? And I think there's always argument as to whether or not are we looking to make money to pay for health care? Are we looking to discourage use? Are there other ways to discourage use? Can we use prevention dollars to get into the schools and educate as to the impact, the dangers of e-cigarettes and nicotine? Can we get back to the family to start taking more of a preventive approach to medical issues rather than a proactive approach in that regard? So, yeah, I mean, I think you could look at any sin tax, gambling, lottery, alcohol, tobacco, and then try to drill down what are we trying to garner from this? Decreased use, increased income, a little bit of both. So that's where I think we can also use these other methods and really try to get our point across that it's no mystery. There's no debate that smoking is bad for your health, and yet, as a society, we continue to be overutilizers of tobacco as a society. So.
You're watching a special edition of In Focus on Whitewater Community Television's WGTV Channel 11. We're speaking with Senator Jeff Raatz, Representative Brad Barrett joining us, and Dr. Minji Parker from Indiana University East is handling most of the questioning. We'll go back to him. We're down to our last about 20 minutes or so.
Okay. Just to touch on the topic of medical marijuana. The state of Ohio has approved medical marijuana, and dispensaries are beginning to be built. The city of Dayton has announced its intent to decriminalize possession of small amounts of marijuana. Do you see that as something that Indiana legislature is going to have to deal with pretty soon? I mean, given the proximity of the city of Dayton and Indiana, do you see that as something that you're going to have to deal with pretty soon?
I think so. I mean, you just see this wave across the nation. Just to the north of us, we have a country in Canada that's legalized recreational marijuana, and you can be in Canada in 4 hours, and so. It's coming. Every state has its own characteristics. Every state has its own personality and makeup and politics. And sometimes I hear that we're only the 5th state that's allowing this, and sometimes I hear we're one of 5 states that doesn't allow that. And we have our own identity here. And I've never liked the excuse that everybody's doing something, you need to do it. I mean, I had teenagers, and if that is an argument for doing something, then I question the validity. But the reality of it is that we are faced with an opioid epidemic. There's some thoughts that THC can help in that regard, and yet it's this balance. Every action has a reaction, and it's as a state coming to grips with the idea of, how can we regulate this, introduce it into the state? What can we learn from states that have made mistakes with this? And so honestly, I don't see it happening this year. But to your question, it is on the menu, and we're going to need to deal with that.
And I'd have to agree with Rep. Barrett. I mean, it's out there, most definitely. I really have a hard time wrapping my mind around how Dayton, as a singular piece of the state, could legalize a small portion of recreational use when it's not legal in the state. But then again, it's not legal in the United States, and we have states that are legalizing, and so I suppose it's just a smaller rendition of what's really happening. And so I was in Colorado this past summer with another group of people from Indiana, and we went into a dispensary just for fun to see how it operated. And
Isn't that why most people go into a dispensary?
Right, yeah, well, we weren't looking for gummy bears or brownies or anything, but the process of how the money is transferred, and because it's illegal at the federal level and it's in cash, and then the dangers of the timing of when you exit the building and all the characteristics of handling large amounts of cash and how they deal with it. It's actually ingenuity at its best at the very lowest level, maybe, but nonetheless, I can't think how Dayton would separate themselves from the state. I can't see that happening in Indiana without us, cracking down on something like that. But we'll see what happens.
And that is a problem, from a criminological standpoint.
Sure.
How one entity within a state can just choose to decriminalize something, and criminologists are waiting to see how they're going to actually make this work. Yeah. And a lot of times, the devil is in the details, sure. And we are scratching our heads as well to see exactly how that's going to work.
So how do you get to Cincinnati or Hamilton, Ohio, or a small burg on this side like Eaton, Ohio, from Dayton? And well, I bought it in Dayton. How do you criminalize that?
Right, and then in a way it creates a whole new set of problems because it's still illegal in the other locations unless you have a medical marijuana card, and so that's going to open the door to some interesting things, and typically things like that do have a contagion effect, for lack of a better phrase.
Sure,
they spill over to other states, and it's something we have to think about. But kind of pushing back at a larger level, looking at pandemic issues, moving to legislative issues that may help address rapidly evolving pandemics, whether it's a healthcare pandemic or a crime pandemic or a sustainability pandemic or any type of problem like that. Are there any legislative initiatives out there currently being considered that would help with pandemic preparedness for the state of Indiana?
I can speak to one on the healthcare front, is that there's currently a bill that's coming to the Health Committee that deals with the Indiana State Department of Health and management of pandemic disease. So that if through the CDC, let's look at the hepatitis A outbreak, they're trying to allow the State Department of Health the ability to identify a risky area, whether it's a city or a county or even a state, and then mobilize vaccination in a rapid fashion rather than waiting for a physician to order a prescription, then to go to a pharmacy and get the prescription. It's allowing the State Department of Health to declare a high risk or high need area and then move towards vaccination. And I think that answers one small component of what you're talking about. And then it's interesting on agriculture, we're looking into the regulation of the import of domestic animals from abroad. That it's amazing how these things work, where currently the amount of dogs and cats coming into this country from other countries, are those animals vaccinated? Is there proof of rabies vaccination? I think there have been isolated episodes of a number of dogs brought into an area and they found rabies in one, and then backtracking, trying to figure it out. So the state's working on that, because that can then certainly be a vector of disease spread from animal to human. They're also seeing that in livestock populations. So they're starting, there is this, and I think it's another, since we talked about it earlier, a proactive response to, hey, how can we look at this amongst our domestic animals, our livestock, and then isolated healthcare. issues. So there is some movement underway in that.
And from the Senate side, I don't see any piece of legislation necessarily at this point in time that's out there to address it. But certainly, just like we've seen here in Wayne County, the health department became active, and many people went and took. I don't want to know what the hepatitis
vaccine,
vaccine. You betcha, for Hep A, and so it certainly raises the bar a little bit when you start talking about something in small Wayne County. All of a sudden, we have this hepatitis A outbreak, and I don't know how long it took, but it wasn't long. I don't think it was, but maybe we could have done things quicker and prevented some from ending up with the problem. And so, but again, in the midst of all that, the education that came out of that was something that was actually incredible in my opinion. Instead of so now I'm shake a bunch of hands and I run to the bathroom and wash my hands. So there's care and it takes a part on everybody. So.
Quick follow-up, same kind of idea. How should the state handle? We're seeing, and you're seeing, I'm sure, the measles outbreak that's beginning to run across the country. Hadn't talked about measles for a long time, basically gone. Now we're starting to see it come back. People have made the choice, been given the choice. They don't have to vaccinate. But again, we start to see things come back from that. How should the state be handling that and that conversation with parents? You don't want to get too deeply involved in people's lives, but it does affect other people in that way.
Yeah, I think education is the way we'd like it to happen, as opposed to mandating something. And you just hate to have the strong arm, and yet with vaccinations we realize it's a herd mentality. Not everybody needs to be vaccinated to eliminate a disease, but you need a statistically significant amount. So then that could change by 1 or 2%, and it can then cause a disease to show up suddenly, particularly in a college community where you have a lot of adolescents or younger adults. And so ideally, I'd love to see it happen through education and happening on the front end. But I think occasionally you're going to see where there are strong recommendations or mandates. Having worked in the hospital, it was recommended you get a flu shot. And, a lot of people didn't really want it. If you've ever had the flu, you don't want to get it. It certainly would be easier if you knew that it gave you 100% protection against it, and it doesn't. And so that creates kind of a crack in the recommendation. So to me, I would say education and prevention is the method that I would like to use to help spread that word.
Is there any conversation with the state about being able to provide more money? Because part of it is misinformation is out there about it. So how do you provide enough information so that correct information gets pushed over the top?
It comes down to money at the end of the day, and everybody's
and
at
a plan.
Understood. I hadn't followed the measles outbreak, or the cases that are out there, and if we know the foundation, is it because they weren't immunized, or what happened? I don't know. I'm asking the question actually. Was that the foundation of the issue, or is there another strain?
No, I think it's because vaccination numbers have dropped. That there's been, and maybe a little bit due to social media, an idea that there was some safety issues with vaccination and kind of a misinformation, because I do not believe there's any medical evidence that shows there was some talk about association with autism and reactions to vaccines and that kind of thing, which it's never zero, but I think a lot of it's been misinformation, in my opinion.
You're watching a special edition of In Focus on Whitewater Community Television's WGTV Channel 11. We're down to our last 8 minutes or so with Representative Brad Barrett and State Senator Jeff Raatz. Dr. Mindy Parker from Indiana University East going to start to take us home.
Okay. So a final question that deals with sustainability. And this is beginning to be a reoccurring theme at different shops and places I go. Are there any legislative initiatives to promote long-term sustainability at the state level for critical infrastructure, things such as water reclamation or power, as far as sustainability, solar power, wind power, those types of things, water reclamation or reducing carbon emissions or promoting more electric vehicle charging stations. Are there any legislative initiatives that would help promote those types of sustainable, renewable energy sources for long periods of time?
I could speak to a couple of those. We talk about wind power, and so we see Randolph County, the county north of us, has seen a great proliferation of that, and they're going to be extending it. Wayne County, on the other hand, the citizenry has stood up and said, no, we don't want to do this, and so it's a largely heated debate when it comes to the local desires, and so we talk about Fayette County. They've gone through the same thing. I think they're on the other side of it. Rush County, basically the same thing, whether they should do it or not. And so from that standpoint, and it bothers some people. I know an individual that went up to Randolph County and said, I can't believe it's horrible. And I go up there and it doesn't bother me a bit. I kind of like it, actually. But at the end of the day, there has not been any initiative necessarily statewide to proliferate some of these sustainable sources of energy. There is a bill actually this year, and I believe it's going to a summer study committee that would be for the west side of the state, taking carbon and infusing it into the ground at the 10,000 foot level, which is create a lot of conversation, and necessarily so. It's happening in other states and has been for a while, but the federal government is incentivizing that to a huge degree. And so that probably will happen in the state, I would say. But that creates a lot of question. We're talking about groundwater and you know then the cracking of the earth underneath with the pressure, and are we creating ourselves earthquake capacity? Or so there are all kinds of things that are being debated, trying to determine exactly where that stands, and the type of soil we have here versus Texas, I think, is a state that does quite a bit of that. And so a lot of questions that are necessarily vetted to determine where that goes. One of the last thing I'll comment on solar energy, several years ago we passed a bill that somewhat limited the payback in a residential home that would spend some money on a sustainable solar energy. And the concept there is if we paid the individual back at the retail rate, and maybe they end up with a zero bill at the end of the year. They produce enough energy in the summertime that would offset their winter bill for electricity. Then who's responsible for the transmission and the cost of the infrastructure that gets the energy to them when they need it and buys it when they don't need it? Because they're not sharing the process anymore. If they're net zero, it's called net metering. If they're net zero cost at the end of the year, then the rest of the citizenry end up paying for the infrastructure to send the electricity to that house and take it back. And so that was the basis behind it. And did we strike a balance in favor of solar energy? Probably not, but we need to get there. And the hope was that as solar energy becomes more proficient and cost effective, then we can see it happen. And so that's the concept there, and those are the few things that I know enough about to feel safe sharing on.
And I do know that on Ways and Means we've talked about improving the state's water infrastructure. Mm-hmm. There's a lot of attention and a lot of money being set aside for that. I think they're still in the process of working at those details. I had a dinner the other night with some of the Centerville leadership, and they were speaking about their water mains and the numbers of issues that they had in the last year, and that a lot of the water infrastructure has been in place since World War II. Yeah. And so we're seeing old pipes and old connections, and an idea that what's under the ground isn't always visible to the eye, and yet we're realizing as a state this is something we better address before it becomes more of an issue. So.
I think you'd be surprised if you took a look at, when you speak about that, right here in Richmond, saw I don't know if it had to be a sewer line, and it might have been surface water, but there was an old wooden barrel that was a piece of the system, and just because we've been around for a long time and it's antiquated. And at Centerville, several years ago, when we had 20 degree below weather for like a week and a half or something, some of those water mains broke because the frost went so far down into the ground. And so there's a lot to talk about. And these are issues that are very costly, that need attention, no doubt. And then the availability of water overall. I sat on a committee a couple of years ago that studied the issue, and the groundwater levels and the fluctuation and all those things. And so there's certainly all those conversations are being had.
Gentlemen, thank you very much. Dr. Benji Parker, Representative Brad Barrett, State Senator Jeff Raatz. You all are back and forth to Indianapolis still for another 2-3 week session is scheduled to end when?
5 weeks.
Yeah.
5 weeks.
Yes,
26th,
at the very end of the month.
Yeah.
Okay.
Not that I'm counting, not that I'm keeping track of that. But,
Getting me out of here? Is that where
it's
we
a
are?
lot. It's a lot of work.
Ready to be done.
Appreciate you all taking some of your time to come in and answer some questions and talk with us. Hopefully after the session is completely over, maybe we can get you back, get a final wrap up, what passed, what didn't, and let some of the residents know of things that they need to be aware of.
Thank you.
Dr.
Okay,
Parker, thank you
thank you.
very much for spending some time with us today.
Thank you for having me.
Before we get out of here, a couple of things I want to remind you. Supposedly it's spring. If you're starting to do some spring cleaning and you have some e-waste recycling that you need to get rid of, this Saturday is actually the day. E-waste recycling happens here on the IU East campus every fourth Saturday. Free recycling for broken and old electronics. Paper shredding is not available, and other TVs with CRTs are not available, but that's 9 to noon here on the IU East campus in the Whitewater Hall parking lot. I want to remind you that WCTV's 6th annual fundraiser, our 21 for Fun, is coming up on Friday night, April 12th. It will be at the Elks. Tickets are available. You can go to WCTV.info for more information, or Awanda Gallery and Gifts, where you can get your tickets. Special thanks to our sponsors, First Bank Richmond, Reed Health, and Cronin Toyota and Cronin Nissan for helping us out with that. Casino games, we'll have a live music, table games, blackjack, craps, roulette, food being provided by Chef Dugan Wetzel, host of iHeart Cooking here on WETV Channel 20. And also bringing in a magician this year, getting a little sleight of hand, so that's going to be there. Also want to remind you that the 2019 primary election season is going to be coming to an end. Voter registration continues through April 8th. You can vote. Check your voter registration, indianavoter.com. We'll have a special In Focus candidate forum on Thursday, April 18th, 6 p.m., 90 minutes with Dave Snow and Jack Cruz. We will be taking your questions for that. And because this show will be re-airing in early April, I want to remind you that in-person absentee voting actually starts on Tuesday, April 9th. The voter registration office, 301 East Main Street in Richmond. Last day for that is on May 6th. In-person absentee or early voting actually begins April 29th and runs through May 3rd. That'll be from 10 till 7. Thank you very much for watching this special edition of In Focus on Whitewater Community Television's WGTV Channel 11. Have a great weekend.